So for the next sexual issue we should be looking at is what is known as what? Hypogonadism. Hypogonadism. Right? So hypo just simply means something is little. Gonadism has to do with the gonads. Those are your genitals, you know, anything that has to do with your genitals, the hormone that controls them, and all of that. So hypogonadism is just a condition where the body's sex glands, right? If you are talking about males, it's testes. If you are talking about ovaries, it's females. So they are producing what? Little sex hormones, right? So testosterones are little in men, estrogens are little in women, you know. So just so you know, those hormones are very important for sexual development, reproduction and function, and your overall health. That means somebody that has what? Hypogonadism will be having all those complications in their sexual life, reproductive life. Okay, also their health will not be cool, you know. So hypogonadism, the type, it could be primary. So this one, the problem is in the gonads themselves. It could be secondary. Now this one, the issues is from the brain. You know, the brain controls every gland in the body. So those glands are normal, but the brain has some issues, right? It could be what? Eugonadotropic. This one is normal gonadotropin levels, but there's impaired ovarian function. Primary one is hypergonadotropic. Secondary one is what? Hypogonadotropic, you know. So causes, several things could cause your sex glands to actually be producing little hormone. Klinefelter's, Turner syndrome, Kalman syndrome, right? Mumps, HIV, okay? Tumors like pituitary adenomas, autoimmune disease like Addison's disease. Alright, some side effects of some drugs like opioids, steroids, chemotherapy. Lifestyle factors like you are so obese, you are so fat, you know, malnutrition, excessive exercise, right? Aging is natural decline in hormone levels, especially testosterone in men. Alright, so these are the common signs that have to do with males, females, and all of that. Okay, so in males, the man is no longer interested in sex, you know, low libido, erectile dysfunction, infertility, reduced muscle mass, gynecomastia. In women, the periods are irregular or totally even absent. Infertility, hot flashes, you know, breast atrophy. All right. So both sexes, they'll be tired, they'll be depressed. Right. Bones are no longer strong. Diagnosis, you just have to do a blood test. You do imagings, genetic testing to check if there's actually linked, you know, to something that had to do with somebody who was giving birth like that, you know. There's semen analysis in men. Treatment is, you know that you are lacking some hormones like estrogen, testosterone, when those glands are not working well. So you replace testosterone for males, you give estrogen only or plus progesterone for women, right? Gonadotropin therapy, surgery, or radiation. Then lifestyle changes.